What's up, everybody? It's Kim coming at you with video 4 of my vitamin deficiency video series. There are 5 videos. If you haven't seen the other 3, go check those out. So let's just jump right in. This video is going to be about my health diagnosis, all of the medical, well, not all of the medical conditions, but the things that I was diagnosed with once entering the hospital, and then the main thing that I was diagnosed with upon leaving the hospital and going into rehab. Okay, so yeah, I have my laptop here with all the notes. All of these came from, the healthcare summary that they give you once you are discharged, and they're obviously like medical words and whatnot. So I'll tell you the word, and then I'll give the definition, and so let's just jump right in. So if you haven't seen those other videos, you gotta go over there and watch those before you watch this, because this won't make sense. Okay, so medical problems that I had when they admitted me into the hospital. So at that point, I was admitted into the hospital at the end of August of 2020. I was unconscious. I had no idea what was going on. From what people told me, they admitted me. They had to do a number of tests, obviously, to just see what the heck was going on in the first place. When I woke up, probably a day or 2 later, my arms, how they give you blood, take blood from your arms. This arm was so scratched up and so bruised. It was horrible. And it was little etches. It was really weird in my opinion, but maybe they were just having problems. They're trying to rush and do stuff. I wish I hadn't worn a button up, because I wish I could probably, well, I have a picture. If I pop it up on the screen, I'll show you the picture of my arm being all scratched up. And I still have a little bruise there, but from far away, you can see that bruise, but I'll pop up the picture to show you how messed up my arm was. And I can't even get blood from this arm anymore. That's how bad this arm was just messed up. And I have to get blood strictly from this arm. And I have to get blood drawn from me every 6 or so months to make sure my vitamin levels are good. But again, let's jump into this. The first thing was called hypernatremia. Now, hypernatremia is a high concentration of sodium in the blood. Most often occurs in people who don't drink enough water. This is usually because of impaired thirst or mental judgment. So if you went back and watched video number 2 of what psychosis feels like, you'll know why this happened. I guess I can backtrack and explain it a little bit here too. During psychosis, I had lack of mental judgment, and I wasn't eating or drinking much of anything. And when I did, I would throw it up. So lack of water to dilute the sodium that's in our blood causes hypernatremia, which is a high concentration of sodium in the blood. Okay. Number 2, lithium. Lithium is approved by the U.S. Food and Drug Administration, FDA, as prescription medication for bipolar disorder. Severe lithium toxicity happens at a level of 2.0 and above, which can be life-threatening in rare cases. So my lithium level was 2. It was high and life-threatening. I don't know where it came from. Nobody knows why I had high lithium content. I was not taking any type of bipolar medication or any type of medication at all for me to have that in my system, and yet I did. Moving on. CPK. CPK stands for creatine kinase. It's an enzyme that leaks out of damaged muscle. When elevated CK levels are found in a blood sample, it usually means muscle is being destroyed by some abnormal process. Normal levels are under 200 for female, and mine was 652. That's most likely happened because of the fact that, I got neuropathy and all that stuff because of the B12 deficiency. It messes with your peripheral nervous system. So Um, this was leaking out because my nerves were becoming damaged, which was causing muscles to damage and all that other stuff. Also, keep in mind, I'm not a doctor. I'm not going to explain this stuff well at all. I'm still in the process of really understanding everything. This was one step I took when I first got discharged to understanding what the heck was going on. I haven't done a lot of research after the fact. So don't be mad at me if I'm not like spot on with my explanations, okay? This is just me getting out what happened to me, basically. If you have a better explanation, put it down in the comments. I would love to hear it. I would love to hear your understanding, etc., etc. I want to make sure there's not a lot of glare on my face, but you're gonna see the glare on my glasses. Okay, the next one, metabolic acidosis, high levels of acid in the body. Next one, rhabdomyolysis. That's a big one. Rhabdomyolysis is a breakdown of muscle tissue that releases a damaging protein into the blood. This muscle tissue breakdown results in the release of protein, myoglobin. Myoglobin can damage the kidneys. So there's that one. Next one, oligornuric renal failure. Minimal or not enough urine output that can injure kidney. So I'm guessing if I wasn't eating none or drinking none, there was nothing for me to pee out. Yeah. Just like you all know, I had no kidney issues once I was discharged. So it was like all of this was caught quick enough for it to not cause severe damage. Next one, acute demilination. Acute demilination. When the body's immune system attacks itself, severe cases can cause things like multiple sclerosis, MS. So I'm gonna talk about it later, but I did not get MS, and I'll explain how they found that out later. The next one, microcytic hypochromic anemia, which is just the iron deficiency, and I had that before I went to the hospital. But I did not take iron. I did not take that anemia serious at all until now, until after I went through all of this stuff. So moving on, thrombocytopenia, which is a low blood cell count. The blood cell's job is to transport oxygen to the body's tissues. Lack of oxygen in the tissue causes tissue damage. So as you can see, there are just layers and layers of stuff within my skin, within my mostly legs was just getting messed up. Okay. Moving on, starvation ketosis. Ketone bodies are the water-soluble molecules that are produced by the liver from fatty acids during periods of low food intake. The body using other sources to stay alive. So yeah, my body was like feeding off of the fat in my body to stay alive since I wasn't eating anything. Next one, pernicious anemia. Pernicious anemia is a decrease in blood cells and the body lacking the ability or a thing called intrinsic factor to absorb B12. So in explaining this, so much, I wish I would have done this a little earlier because I did have a better explanation of it like when I first got it or whatever, when I first got all this stuff. Right now it's like, because in the hospital when this lady told me about intrinsic factor, I was like, that sounds fake as hell. You're lying to me. Get me out of here. My body has a thing called intrinsic factor. I'm not a robot. That sounds like some robotic ad. But yeah, intrinsic factor helps your body absorb B12, and my body was lacking that ability. And so yeah, but the thing about it is I still take an oral B12 pill, and so I don't have to take the shot in order for my body to absorb it. I just have to take that pill every day. So that's I'm kind of lucky in that regard, because having to go once a month to the hospital to take a shot is excessive and annoying. So yeah, my body absorbs enough to get by on a pill. Moving on. Next one, neuropathy. Neuropathy is pain, a pins and needles sensation, causing numbness and weakness. I still have neuropathy in my legs and in my feet and a bit like from waist down. I usually just tell people it's like tight in my waist, a little numb, a little bit, but not so much. But the numbness is mostly, or the tingling is mostly in my feet, and then numbness is like waist down and also in my feet. My feet feel like I've been sitting on them for too long, but it feels like that all the time. It was horrible at first, and it was really bad. Like my whole like waist down body legs situation was horrible when I was pregnant. But it's gotten a lot better. I can move around so much better. I don't feel as stiff. My back still feels stiff, but it's not like painful anymore. I can actually ignore it at this point. And it does get better and better and better with time. And it feels the best when I am eating like super clean. Like if I ate just fruits and vegetables and water every day, I'm pretty sure I would feel pretty close to being back to myself. But I just don't do that. It's a little hard. That's another video to talk about me and my like health and food habits and stuff. Because I do have very strong stints in which I do eat really, really healthy, but they don't last. But let's keep moving. Psychosis, which is a video, the second video that I made. It's a mental disorder characterized by disconnection from reality. Symptoms include delusions, hallucinations, talking incoherently, and agitation. The person with the condition usually isn't aware of his or her behavior. Had psychosis for at least a month. At least. Watch that other video to get more details on that. Vitamin B12. Put this definition in here to understand what it did for my body. It's a nutrient that helps keep the body's nerve and blood cells healthy and helps make DNA. It has been highly linked to several psychiatric disorders like impaired memory, irritability, depression, dementia, delirium, schizophrenia, and psychosis. So, before I even knew I even had like a vitamin B12 deficiency, I was like so irritable. I was just like pissed at everything and everybody. Like I would order food and just get so pissed at the delivery people for like not knowing how to get to my door and stuff. And I don't know. I was just mean for no reason. And this explains it. And like there was like one time last year where I didn't have my B12 pill and I think my numbers got a little too low and I could feel myself getting irritable. And that was like a trigger for me to know like I need to get that. I need my B12. So yeah, let's keep moving. Vitamin B12 deficiency, nervous system injury. The symptoms are memory loss, pale skin, reduced sensation of touch, shortness of breath, or tingling in the feet. During psychosis, I had like some crazy tingling in my feet, and being under psychosis, I didn't understand it. And watch the other video to get more details on that. There's more. So tingling in feet. Damage to the nervous system could cause a change in the way a person walks and moves. It could even affect balance and coordination, making them more prone to falling. So, the different procedures that I had done while I was in the hospital, there's a number of them. First, they did a CAT scan. That was before I was even conscious, I believe, because I don't remember getting a CAT scan done. They had a heart monitor on me, like on my chest, to make sure my heart was beating okay. It's just like these little stickers all over your chest, and then there's like a block phone size thing that just sits in your bed, and they're monitoring it from their desk, making sure the numbers stay normal. I got an ultrasound. I don't remember this too much. Well, I got an ultrasound of my leg before I was like in the hospital, like when I went to the emergency room, at those first couple of times of my leg, just look for blood clots and stuff. I got an MRI. I was awake for that. it was weird because you're just in this like this tube, and it's really loud, and they give you music to listen to, and it's a little bit claustrophobic, and you're in there for like a while. It didn't really feel like that long, you know, being in there, especially since I wasn't really coherent yet. It was like probably day 5 or so of me being in the hospital. I still wasn't all the way here, you know. But I remember the experience, and they would like pull you out to like let you breathe or whatever, like just to chill, and then put you back in. I think I did it for like an hour, on and off. I think I got a break every 20 minutes or so, or 30 minutes or so. MRIs are weird though. And then the last thing was a lumbar puncture. This is so weird to me. So the lumbar puncture was for them to check to see if I had MS with multiple, these words, man, multiple sclerosis. And they did it once, and it's like this clear liquid that comes out of your back, and the spiritual person in me feels mad and dumb that they took a liquid from my spine out of me, thinking about it now. But then they got the results, and they're like, oh, we got all the results back except for MS. We're gonna have to take more out of your fucking back. Kim now is pissed that Kim decided to do it. One, because after the fact, my back hurt. Like, it hurts now to this day after the second lumbar puncture. And two, part of me thinks they just took it so they could use it for some shit. Like, I had some good clear spine liquid, and they just wanted more of it or some shit. But I did it the second time, and then they got the results that they needed. So yeah, I never do a lumbar puncture again. It's like they used the scare tactic on me. They're like, we have to make sure that you don't have MS, so you need to do it again. And it's like, why didn't it work the first time? That was the one thing that let's move on. So that was my medical conditions. Those were the procedures that they did on me. And then this was my treatment. How they not healed me, but helped me to get better in about a month's time. Yeah. And I'm like, is that including rehab? I think it does. No. Yeah. Okay. So moving. So these are my treatments. I got Solumedrol, which is a steroid. It can treat inflammation, severe allergies, flares of chronic illnesses, and many other medical problems. Sodium chloride, which is salt, an electrolyte and mineral. It helps keep the water, the amount of fluid inside and outside the body cells, in electrolyte balance of the body. Sodium is also important in how nerves and muscles work. Most of the sodium in the body, about 85% of it, is found in the blood. A cyanocobalamin injection, which is a B12 shot. Pyridoxine, which is vitamin B6. It's required by your body for utilization of energy in the foods you eat, production of blood cells, and proper functioning of nerves. But you can't have too much B6 because it is toxic if you get too much of it. A lot of vitamins, if you get more than you need, you can just pee it out, but not with B6. Don't get too much. And then the last two things. Thiamine, which is B1. It enables the body to use carbohydrates as energy. It is essential for glucose metabolism, and it plays a key role in nerve, muscle, and heart function. Physical and occupational therapy. That was the last thing. So I had 1 month of inpatient in the hospital, urgent care, ICU. 2 months, or ICU and rehab for a month. Inpatient rehab and, so actually I had 2 months of inpatient physical and occupational therapy. That was like the most intense. And I'm gonna talk about my experience in rehabilitation for my legs in the next video, if I haven't talked about it already. 2 months at home. So yeah, I lived in an apartment by myself, and so a couple nurses would come I think maybe once or twice a week to, you know, do physical and occupational therapy. Occupational therapist left relatively quickly, but the physical therapist stayed for a little while longer, like for 2 months. I feel like it was 3 months, but I guess it was 2 months. And 3 months outpatient in facility. So once January came and I was able to drive a little bit, I would go to a facility about 15 minutes down the road, and do mostly just physical therapy there. Yeah, just physical therapy. I didn't get occupational therapy after a while. So those were my medical conditions. Those are the procedures I had done in the hospital, and that was the treatment that I was given. Do I think that it helped me? Yes, I think I'm doing fine. Am I still, am I well? Like, am I 100%? No, I'm not 100%. I can't run at full speed. My back still pains me. I had a chiropractic appointment. I just didn't go because I don't remember, but I need to schedule another one, so that would help my back. My legs are a little heavy still. I'm not who I was physically 3 years ago, but I am fully functional. Yeah. I will say one thing I didn't talk about was I was in a wheelchair. Well, yeah, I talk about it during my other videos, but I was bedridden for a month and did physical therapy twice a week in the hospital in ICU. But I didn't really move at all, barely, you know. And then I was in a wheelchair and also getting my strength back to walking while I was in rehab. And so I was in a wheelchair and I had a walker then. And then when I left rehab, I was still in a wheelchair and I still had a walker. But I had to eventually get out of the wheelchair. So I wound up getting out of the wheelchair on a walker for the most part. And then probably like 4 months later, I was able to just use a wheelie walker. Let me count. October, November, December. Yeah, by January, I was using a wheelie walker and I was good. Maybe even by December, I was just using my wheelie walker, if I'm being honest, because that's when I was, it's a bit of a blur, but just know that I was like driving at the end of January. So obviously I was using my wheelie walker pretty quickly. And there's a difference. Like a regular walker, it makes you go slower because it doesn't have wheels, and you need it to go slow so you can take little steps. But the wheelie walker helps you go faster, and it has a little seat when you get tired. And I use the wheelie walker, or I brought it around with me often just in case I got tired and I needed some support. Yeah, so those were like the mechanisms that I used to get better too. Those 3 things. And my insurance covered all of this stuff. I didn't have to pay out of pocket. I had really good insurance at the time because I still had my job. Me talking about my job and how it affected that is in a different video as well. So you gotta watch the whole series to get the full story, guys. So I'm gonna be out. Thanks for watching this. Tune into the next one. See you later.